Dear students, welcome back. In the previous session we have discussed about knee flexors. Now we are going to discuss about knee extensors. Okay, so the four extensors of the knee are, one is the rectus femoris, okay, vastus medialis muscle, vastus lateralis muscle, and vastus intermedius, which is present below this rectus femoris. Here you can see this is vastus intermedius muscle. So all these four muscles are collectively known as quadriceps femoris muscle. The only portion of the quadriceps that crosses two joints is the rectus femoris. Only the rectus femoris muscle is going to cross the two joints as well as hip and knee joint. As we know that this rectus femoris is originating from the anterior inferior iliac spine. Okay, yes. Now the vastus intermedius, the vastus lateralis, here you can observe the vastus intermedius, vastus medius and vastus lateralis originate on the femur along the trochanteric line. Okay, originate from the femur and merge with the rectus femoris muscle into a common tendon called as quadriceps tendon. So this is the quadriceps tendon. Okay, this quadriceps tendon inserts into the proximal aspect of the patella. Okay, where it is known as patellar tendon or patellar ligament. This patellar tendon then afterwards, after attaching in the apex, so this patellar tendon runs from the apex of the patella into the proximal portion of the tibial tuberosity, and from here it is going to run and it is getting inserted into the proximal portion of the tibial tuberosity. But as the vastus medialis and vastus lateralis also insert directly into the medial and lateral aspects of the patella by the way of retinacular fibers of the joint capsule. So this thing we have already discussed in the extensor retinacula. Okay, together the four components of the quadriceps femoris muscle function to extend the knee. Okay, here in this one also you can see the insertion point of vastus medius, so on the medial aspect of the tendon, whereas the vastus lateralis on the lateral aspect of the patella. Okay, yes. And some of the studies by Lieb and Perry examined the direction of pull of each components of the quadriceps. Okay, the pull of the vastus lateralis muscle. So the pull of the vastus lateralis muscle alone, this muscle, was found to be 12 degrees to 15 degrees lateral to the long axis of the femur. So we know this is the long axis of the femur, isn't it? So to the long axis of the femur, this action line of this vastus lateralis makes an angle of, okay, this is making an angle with the what you call as long axis of the femur is 12 degrees to 15 degrees. Okay, and if you see this distal fibers of this same muscle, which is angled still more. Okay, normally the fibers at the top will get 12 to 15 degrees overall, but at the distal fibers of this muscle is going to angled more. Okay, next the pull of vastus intermedius, so which is exactly present parallel to the long axis of the femur. So this contraction of this vastus intermedius forms the purest knee extensor of the group. So this forms the pure extensor of the group. Which part of the quadriceps muscle is the pure extensor? Vastus intermedius. The angulation of pull of vastus medialis. Now we'll see the angle of pull. This is the longitudinal axis, okay, of the femur. Again we'll draw this one. Yes, this one is the longitudinal axis of the femur. Now we will see how this vastus medius is going to work. The angulation of pull of the vastus medialis muscle depend on which segment of that muscle was assessed. So here it is having a variation of angulations in the upper fibers of the vastus medius as well as the distal portion of the vastus medius. Okay, the upper fibers were angled 15 degrees to 18 degrees medially to the femoral shaft, whereas the distal fibers were angled as much as 50 degrees, 50 degrees to 55 degrees medially. Okay, and other investigators like Powers and their colleagues, using more current technology, reported that the resultant pull of the vastus lateralis muscle, was 35 degrees laterally, whereas the resultant pull of the vastus medialis is 40 degrees medially. Okay, because of the drastically different orientation of the upper and lower fibers of the vastus medialis muscle, the upper fibers are commonly referred to as vastus medialis longus, that is VML. The upper fibers of vastus medialis is called as vastus medialis longus, and the lower fibers of the same muscle, that is vastus medialis muscle, lower fibers are called as vastus medialis oblique. Okay, the obliquity of the distal portion of the vastus medialis muscle has become the focus of attention in patients with patellofemoral pain, as clinicians and researchers have attempted to try to preferentially recruit this vastus medialis oblique to maximize its medial pull, okay, to maximize its medial pull on the patella. Okay, and also if you we can easily appreciate when we ask the patient to contract the quadriceps muscle, which side of the muscle is going to contract, then you can easily identify which muscle is working properly with our eyes itself. Okay, and so these are some of the studies noted by some of the investigators, and also Lieb and Perry found the resultant pull of the four portions of the quadriceps muscle to be 7 degrees to 10 degrees in lateral direction and 3 to 5 degrees anteriorly in relation to the long axis of the femur. Okay, and Powers and colleagues, however, used a multi-plane analysis, okay, and noted the relatively large vastus lateralis. So, relatively large vastus lateralis and vastus medialis muscle have a posterior attachment side. Here you can find the ranges of variation here. Vastus medialis is somewhat greater, 40 degrees, and vastus lateralis is 35 degrees. Okay, and also because of their attachments on the posterior side, which results in a net posterior or compressive forces that averages 55 degrees in the extended knee. Okay, the compressive force from these muscles is present. So the forces which are created by all these muscles leads to some compressive forces from all these muscles is present throughout the range of motion, but it is minimized at full extension and increases, the compressive force is going to increases as the knee flexion continues. Okay, so how these forces are going to be minimized in full extension and it is going to increase in knee flexion because it is having some patellar influence on the quadriceps muscle function. So the patellar influence on the quadriceps muscle function we can discuss in the next session. Thank you.